HIV. Let's understand asymptomatic HIV coding. If a patient is HIV positive but does not have any HIV related conditions, we assign the code Z21, which represents asymptomatic HIV status. So, whenever you see documentation like HIV, HIV positive, or HIV status, and no complications or related conditions are mentioned, you should assign Z21. For example, a patient comes to the hospital with an injury and is also HIV positive, but there are no HIV related conditions mentioned. In this case, we code the injury as the principal diagnosis, followed by Z21 as secondary diagnosis. So remember, HIV is present but no related conditions, so we assign asymptomatic HIV status. Now let's solve a question. A patient comes with fracture and is known HIV positive but has no HIV related symptoms. What is the correct coding? The correct answer is option B, fracture plus Z21. Because the reason for visit is fracture, so fracture will be coded first. And since the patient is HIV positive without any related condition, we assign Z21 as secondary diagnosis. We should not use B20 because there are no HIV related conditions. Let's clearly understand symptomatic HIV coding. If a patient with HIV presents with any HIV related condition, we assign B20, which represents AIDS, as the principal diagnosis. Very important. We should not stop at B20. We must also code the HIV related condition. For example, if the patient has HIV and candidiasis, we assign B20 first, followed by the code for candidiasis. So the rule is B20 first, then the related condition. In this question, the patient has HIV disease along with candidiasis, which is an HIV related condition. According to ICD-10-CM Guidelines, when HIV is associated with any related condition, we must assign B20 as the principal diagnosis, followed by the code for the related condition. So the correct answer is option C, B20 plus candidiasis. Option A is incorrect because HIV must be coded. Option B is incomplete because the related condition is not coded. Option D is incorrect because Z21 is only for asymptomatic HIV. Now understand the sequencing clearly. Whenever HIV is associated with a related condition, we always code both conditions. B20 will be coded first as the principal diagnosis, followed by the HIV related condition. For example, if an HIV patient is admitted for tuberculosis of lungs, we assign B20 first, followed by A15.0. So remember, never code only B20. Always code the associated condition also. In this scenario, the patient has HIV disease and is being treated for pulmonary tuberculosis. Tuberculosis is an HIV-related condition, so we must assign B20 first as the principal diagnosis, followed by A15.0. So the correct answer is option B, B20 followed by A15.0. Option A is incorrect because sequencing is reversed. Option C is incorrect because Z21 is used only for asymptomatic HIV. Option D is incomplete because HIV must also be coded. Now let's look at a very important exception. If an HIV patient is admitted for treatment of hemolytic uremic syndrome associated with HIV, we do not assign B20 as the principal diagnosis. Instead, we assign D59.31 as the principal diagnosis, followed by B20. This is a specific guideline exception and is frequently tested in exams. This is an exception-based question. Although the patient has AIDS, when the admission is specifically for hemolytic uremic syndrome associated with HIV, we assign D59.31 as the principal diagnosis, followed by B20. So the correct answer is option B, D59.31 followed by B20. Option A is incorrect because B20 is not sequenced first in this case. Options C and D are incomplete because both conditions must be coded. B20 first, then condition. But HUS breaks the rule. Let's understand a very important rule in HIV coding. If a patient with HIV presents to the hospital for a condition that is not related to HIV, such as fracture, injury, burn, or any unrelated condition, we should code that condition as the principal diagnosis. After that, we assign the HIV code as a secondary diagnosis. So remember, when the condition is not related to HIV, reason for visit comes first, not B20. In this question, the patient has HIV disease but presents with a fracture due to an accident. The fracture is not related to HIV, so we must code the fracture as the principal diagnosis followed by the HIV code. Since the patient is a known HIV disease case, we assign B20 as secondary diagnosis. So the correct answer is option B, fracture first, followed by B20. Option A is incorrect because B20 should not be first. Option C is incorrect because Z21 is used only for asymptomatic HIV. Option D is incomplete because HIV must also be coded. Now understand the logic clearly. Principal diagnosis is always based on the reason for visit. Even if HIV is present, if it is not related to the current condition, it should not be coded first. So don't get confused by the presence of HIV. Focus on why the patient came to the hospital. In this scenario, the patient has AIDS but is presenting for treatment of burns. Burn is the reason for visit and is not related to HIV, so burn must be coded as the principal diagnosis. B20 will be coded as secondary diagnosis, so the correct answer is option B, burn of arm. Option A is incorrect because HIV is not the reason for this visit. Option C is incorrect because Z21 is for asymptomatic HIV. Let's understand a very important rule in HIV coding. Only confirmed cases of HIV should be coded in any department, whether it is inpatient or outpatient. If the documentation says suspected, possible, probable, or rule out HIV, we should not assign HIV codes. Instead, we code the patient's signs and symptoms. So remember, no confirmation means no HIV code. In this scenario, the physician has documented suspected HIV, but there is no confirmed diagnosis. According to ICD-10-CM Guidelines, only confirmed HIV cases should be coded. So we should not assign B20 or Z21. We also do not assign R75 because that is used for inconclusive test results, not for suspected cases. So we code only the symptoms, which is fever. The correct answer is option C, code for fever only. This rule is very important because it is different from general inpatient coding guidelines. Normally, in inpatient settings, we can code suspected or probable conditions, but HIV is an exception. Even in inpatient cases, we should not code suspected HIV. Only confirmed HIV cases should be coded. In this case, even though the patient is admitted as inpatient, the diagnosis is still only possible HIV, not confirmed. HIV follows a strict rule. Only confirmed cases are coded, even in inpatient settings. So we should not assign B20 or Z21. We also do not assign R75 because there are no inconclusive test results yet. So we code only the symptoms like weight loss and cough. The correct answer is option C, code symptoms only. Let's quickly summarize. If HIV is confirmed, we assign either B20 or Z21 depending on symptoms. If HIV is suspected or not confirmed, we should not assign HIV codes. Instead, we code only the symptoms. In this question, the physician has documented rule out HIV, which means the diagnosis is not confirmed. According to guidelines, we should not assign any HIV codes in this situation. Instead, we code the symptoms such as fever and lymphadenopathy. So the correct answer is option D, assign codes for symptoms only. Options A and B are incorrect because HIV is not confirmed. Option C is also incorrect because HIV codes should not be used at all. Let's understand a very important rule in HIV coding. Once a patient is diagnosed with AIDS and B20 has been assigned at any point, we must continue to assign B20 in all future visits. Even if the patient does not have any HIV related condition later, we should not go back to Z21. So remember, once AIDS, always AIDS in coding. In this case, the patient was already diagnosed with HIV disease earlier and B20 was assigned. According to guidelines, once B20 is assigned, we must continue to assign B20 in all future encounters, even if no related condition is present. So we should not assign Z21 again. The correct answer is B, B20. Let's understand this with a timeline example. On January 1st, the patient is admitted for HIV with tuberculosis. We assign B20 followed by TB code. After 6 months, the same patient comes for a follow-up visit without any HIV-related condition. Still, we must assign B20 only. We should not assign Z21 in this case. In this question, the patient has a past history of AIDS, so B20 must still be assigned. The current visit is for fracture, so fracture will be coded as the principal diagnosis. B20 will be coded as secondary diagnosis. So the correct answer is C, fracture plus B20, HIV screening versus counseling. If the patient comes to the hospital for HIV testing and the results are not yet known or still pending, we assign the screening code Z11.4. If the patient has any symptoms like fever or cough, we should code those symptoms along with Z11.4. So testing visit means screening code. In this case, the patient is coming for HIV testing and the results are not yet available. So we assign Z11.4 for screening. Since fever is present, we also code fever. So the correct answer is C, Z11.4 plus fever. If the patient comes to the hospital to know his HIV test results and the results are negative, then we assign the counseling code Z71.7. So this is not a testing visit, this is a result visit with counseling. Remember, results visit means counseling code. In this question, the patient is not coming for testing, he is coming to know his HIV test results. Since the results are negative, we assign the counseling code Z71.7. So the correct answer is B, Z71.7. Let's keep it very simple. If the patient comes for testing, we assign Z11.4. If the patient comes to know the results and results are negative, we assign Z71.7. So just remember, testing versus results. In this case, the patient is coming only for HIV testing, so we assign Z11.4 for screening. Z71.7 is incorrect because this is not a results visit. B20 is incorrect because HIV is not confirmed. So the correct answer is B, Z11.4. For test, we assign Z11.4 and for results, it's Z71.7. Let's understand inconclusive HIV coding. If the HIV test results are inconclusive or non-conclusive, it means the diagnosis is not confirmed. In this situation, we assign the code R75, which represents inconclusive laboratory findings for HIV. So remember, not positive, not negative, unclear result means R75. Once P20 assigned, never go back to Z21. In this case, the test result is inconclusive, which means HIV is neither confirmed nor ruled out. So we assign R75 for inconclusive HIV findings. B20 and Z21 are incorrect because HIV is not confirmed. Z11.4 is incorrect because this is not a screening visit. So the correct answer is C, R75. Now understand the difference clearly. If the patient comes for testing, we assign Z11.4. But if the test result comes and it is inconclusive, then we assign R75. So screening is for testing, R75 is for unclear results. In this question, the patient is coming for results and the results are inconclusive. So we assign R75 for inconclusive findings. Z71.7 is incorrect because that is used only when results are negative. Z11.4 is incorrect because that is for testing visits. B20 is incorrect because HIV is not confirmed. So the correct answer is C, R75. Let's quickly summarize all HIV test related scenarios. If HIV is confirmed, we assign B20 or Z21. If the patient comes for testing, we assign Z11.4. If the patient comes for results and they are negative, we assign Z71.7. And if the results are inconclusive, we assign R75. So each situation has a specific code. In this scenario, the patient is coming for test results and the results are inconclusive. So we assign R75. Z71.7 is incorrect because that is used only when results are negative. Z11.4 is incorrect because this is not a testing visit. B20 is incorrect because HIV is not confirmed. So the correct answer is B, R75. Unclear result, assign R75. HIV positive long-term drug therapy, Z79.899. Let's understand an important additional coding rule in HIV. If a patient has HIV disease or AIDS and is currently on antiretroviral medications, we assign B20 as the principal diagnosis. We also code the associated HIV related condition if present. In addition to that, we assign Z79.899, which represents long-term use of medications. So remember, HIV on treatment means one extra code, Z79.899. In this case, the patient has AIDS and is being treated for pneumocystic pneumonia, which is an HIV-related condition. So we assign B20 first, followed by the pneumonia code. Since the patient is also on long-term antiretroviral therapy, we must add Z79.899. So the correct answer is C, B20 pneumonia and Z79.899. Now understand the sequencing clearly. First, we assign B20 for HIV disease. Second, we assign the associated HIV-related condition. Third, we assign Z79.899 for long-term drug therapy. So the order is always B20, then condition, then drug therapy code. In this scenario, the patient has HIV disease and tuberculosis, which is an HIV-related condition. So B20 is coded first, followed by A15.0 for TB. Since the patient is on long-term therapy, we add Z79.899 at the end. So the correct answer is B, B20, A15.0 and Z79.899. Now, one important point. Z79.899 is always an additional code. It should never be used as the principal diagnosis. We assign it only when long-term drug therapy is clearly documented. If there is no mention of ongoing therapy, we should not assign this code. In this case, the patient already has AIDS, so we must assign B20. Even though there are no current HIV-related conditions, since the patient is on long-term therapy, we also assign Z79.899. So the correct answer is C, B20 plus Z79.899. Z21 is incorrect because once AIDS is diagnosed, we never go back to Z21.